All right, let's get right into it. Today we're talking about a medication that is, well, the perfect definition of a double-edged sword in modern medicine. It's called olanzapine. On one hand, it's an absolute powerhouse that has genuinely turned lives around. But on the other, it comes with a pretty serious list of risks we have to unpack.
To really get a handle on olanzapine, you have to see it for what it was at the time, a massive breakthrough. It was part of a class of drugs that completely changed the game for treating severe mental illness.
So what is it exactly? Olanzapine is what's known as an atypical antipsychotic, and that word atypical is the key. See, the older or typical drugs often cause these really severe movement-related side effects. The whole idea behind this new class was to tackle more symptoms of psychosis, but with a different and hopefully a much better side effect profile.
And the impact was just huge. This medication became a cornerstone treatment, a go-to for two of the most difficult conditions out there, schizophrenia and bipolar disorder. So we're not talking about some fringe medication here. This is a frontline defense.
So how does it actually pull this off? Well, it all comes down to rebalancing the brain's incredibly complex chemistry. You can almost think of it like a sound engineer at a mixing board, carefully adjusting the dials on different neurotransmitters to get the sound just right.
What made it so innovative is its dual-action mechanism. First, it blocks dopamine receptors. That's what helps turn down the volume on the positive symptoms of psychosis. Things like hallucinations and delusions. But here's the atypical part. It also blocks certain serotonin receptors. And this is crucial, because that helps with the negative symptoms, like apathy, emotional flatness, and social withdrawal, which the older drugs just couldn't seem to touch.
But here's the catch. That broad action is also exactly where the side effects come from. This chart is basically a perfect blueprint for it. When olanzapine blocks histamine receptors, boom, you get sedation and weight gain. When it hits the muscarinic ones, you're looking at things like dry mouth and constipation. And blocking adrenergic receptors, that can lead to dizziness. It's a very clear cause and effect relationship.
Okay, so with this powerful, complex mechanism in mind, who is this medication actually for? I mean, who is it officially approved to help?
Well, the FDA has given it the green light for some very specific, very serious conditions. It's used to treat schizophrenia, both for getting acute episodes under control and for long-term maintenance. For bipolar 1, it's used for those acute manic episodes and also as a mood stabilizer over the long haul. And here's an interesting one. When you combine it with an antidepressant like fluoxetine, it can be a game changer for people with treatment-resistant depression.
And now we have to flip the coin over and talk about the significant side effects. This really is the cost of treatment, and it's something every single patient and doctor has to weigh very, very carefully.
Let's start with the big one. The most prominent, most challenging side effect of olanzapine is significant and often very rapid weight gain. And we are not talking about 5 or 10 pounds here. It can be substantial, and unfortunately, it's often a gateway to a host of other health problems.
That weight gain is a major piece of a much bigger problem called metabolic syndrome. And this isn't a single disease. It's a cluster of conditions all happening at once. And together, they dramatically increase the risk for some of our biggest killers: heart disease, stroke, and type 2 diabetes.
When it comes to olanzapine, this syndrome usually shows up as a trifecta of problems. First, you've got the significant weight gain we just mentioned. Then you have high blood sugar, which can actually lead to brand new cases of diabetes, even in people who were never at risk before. And finally, it can spike your cholesterol and triglycerides. It's a triple whammy to your metabolic health.
The risks are so serious, in fact, that the FDA put its strongest possible warning on it, a black box warning. The language is incredibly stark and direct. It says that these drugs increase the risk of death in elderly patients who have psychosis related to dementia. It's not a risk you can just brush aside.
So, all of this brings us right back to that central idea, the risk-benefit balance. Choosing to use olanzapine isn't a simple yes or no. It's a critical, ongoing conversation and decision-making process. It really is like a scale. On one side, you have these incredible, life-changing benefits. It quiets psychosis, it stabilizes mood, it can even prevent devastating relapses. But on the other side of that scale is a really heavy burden of side effects. The weight gain, the diabetes risk, the cholesterol. The decision to use it means you're weighing whether those powerful benefits are worth these very serious risks.
So if there's one key takeaway from all of this, it's this. Treatment with olanzapine is absolutely not a set-it-and-forget-it situation. It demands a strong, active partnership between the patient and their doctor. Constant monitoring of weight, blood sugar, and cholesterol isn't just a good idea, it is essential to using this medication as safely as possible.
And that kind of leaves us with a much broader question, one that goes way beyond this single drug. As our medicines get more and more powerful, the trade-offs often get steeper. So the real question for all of us, as patients, as doctors, as a society, is this: how do we get better at balancing these profound, life-altering benefits with some equally serious risks?